What role do you think fascial manipulation plays in modern medicine today?
It's not playing so much yet, but I think that in 10 to 20 years it will change a lot of how we think about symptoms and function.
Oh, why do you say that?
Because
hello, my viewers. It's another great opportunity for me to interview another great medical doctor who is also undertaking fascial manipulation training, being actually in the first world or first international fascial manipulation school. She is a seasoned physician all the way from Norway. Her name is Singrid, but I'll give her the opportunity to introduce herself. As I have always said, is that my interest is to understand why would a physician of her class leave drugs, surgery, and starts paying some attention to manual therapy, and more specific on fascial manipulation. So, Dr. Singrid, thank you for your time and thank you for giving me this opportunity. I would like you to start with a simple introduction: who you are, where you're from, what you do, and how long have you been doing it?
Well, I'm from Norway. I was a medical physician. I was finished in 1983, and I have a specialization in physical medicine and rehabilitation. And my doctoral thesis was on fibromyalgia, the etiology and the treatment and outcome of fibromyalgia patients. And most of my professional life I've been working with chronic pain patients, but also giving rehabilitation to other patients, neurological patients, postoperative patients, rheumatic diseases, and so. I'm also a researcher. I have always been confused that as a medical doctor we learn nothing about the pain from the muscles, the pain that you can't see on x-rays or MRIs and blood tests. And even if the joints have normal situation and you can't find much on the neurology, many patients have pain.
Great. So, how familiar were you with the fascia before coming to fascial manipulation school, or even thinking of coming to fascial manipulation school?
I heard about the fascia first time on an international congress in Spain. Robert Schleip had a very short introduction, and I was interested. And then I didn't know anything before Antonio Stecco started as the president or leader of the International Myopain Society, and they introduced the Wednesday webinars. And I attended some of them and I couldn't understand a thing. To me, this was... And I thought, I have to learn more about this, because nothing kind of made sense, but for one, and that was Natalie Brettler, you know. She had a wonderful session.
The Israeli therapist for the Olympics, right?
Yes. She had a wonderful session where she explained how she was working on the level 4 with the lymphatic drainage from post-surgery breast cancer patients. And she had the pictures before the treatment and after the treatment. And these patients are very difficult to help, but we could really see the results. And I thought, wow, if it can do that superficially, what can it do more deeply? And so I actually, when I saw it was a possibility for the first edition of the International School, I thought, I'll apply. I want to learn this.
Wow. Really researcher mind, because it's that curiosity that you're tapping into. What role do you think fascial manipulation plays in modern medicine today?
It's not playing so much yet, but I think that in 10 to 20 years it will change a lot of how we think about symptoms and function.
Oh, why do you say that?
Because not only do the stecos have a method that functions out of experience, but they are also doing the scientific work to document why it is so. And with their publications and now also the anatomical specimens that they make, which really can demonstrate how the fascia and connective tissue connects everything in the body. And they're so clever, they are teaching many. So now we have a possibility to understand symptoms that we haven't understood before. Now we don't need to say, well, this is just psychological, it's a problematic.
It's in your head.
Yes. We know that it is both. I mean, of course, the brain and our thinking and our understanding is very important for what we feel, but you cannot forget also the input from the muscle and fascial system. And also that treatment, if you are treated in the right way, the effect lasts much longer than other manual techniques